Got it right. Thank you, Mr. PRO.
Welcome on board, sir.
Thank you very much. I appreciate you. Thanks to everyone for coming on board.
Good evening. Can you hear me all?
Yes, we can hear you.
Once again, I apologize for the late start. So due to technological errors.
We understand.
Okay.
Yes.
So good morning, distinguished members of the House, my seniors, my professors, ladies and gentlemen. Reproduction, they say it's a luxury. So, but how do we make it a necessity in livestock? So we're going to talk about how to optimize reproduction such that the livestock business becomes profitable. I'm Muhammad. I work with the Veterinary Teaching Hospital, ABU Zaria, also a technical partner of Genex Nigeria Limited, a breeding company. So our outcome will constitute the following. I'll give an introduction. We'll talk about the goals of reproductive herd health management and control of infectious diseases, genetic selection, nutritional management, reproductive management, diagnosis of reproductive status of the cow, and then we'll talk about male infertility. So without further waste of time, reproductive herd health management plays a critical role in profitable cattle production. Efficient management of reproduction is essential for maximizing reproductive performance. This ultimately leads to increased productivity and profitability of the herd. So what is the aim of any reproductive health management? So mostly it is, the aim is to optimize fertility, breeding, and then pregnancy ultimately. All farmers will want to have their herds or flocks multiplied so that they will make more money. Therefore, it is desirable to have a well-designed reproductive herd health management, which will ensure early diagnosis, treatment, and prevention of reproductive diseases or disorders. Also, it is involved in genetic improvements to ensure increased productivity and sustainability. This is an essential aspect of reproductive herd health management. So we start with control of infectious disease. Disease generally can adversely affect profitability of any given herd. And it indirectly affects reproduction so that when a group of animals are sick, they cannot reproduce optimally. So it's important to have a good disease prevention and control strategy, which is critical for any reproductive herd health management program. The veterinarian should include vaccination programs, biosecurity measures, as well as routine health monitoring programs to help prevent the spread of infectious disease. Major diseases that affect livestock production include CBPP, trypanosomosis, fasciolosis, cardiosis, dermatophilosis, and in small ruminants, parasites and PPR. Next, we have genetic improvements. Genetic improvement can be attained through the use of assisted reproductive technologies. Advances in reproductive technologies have revolutionized the livestock industry. The main reproductive biotechnology that are available in developing countries include artificial insemination and embryo transfer. The benefits and drawbacks of the technology will be discussed. So artificial insemination has been well adapted in Nigeria since in the 1970s. However, a lot of problems have been has been associated with adoption of this technology by farmers. Of course, we talk about the benefits of artificial insemination. It helps in reproductive improvements, such as increased milk production from cows, increased disease resistance, control of disease, possible increase in fertility, decrease in the cost of breeding, as well as utilization of sex semen, which increases the number of female animals in the herd, which ultimately will also increase the number of milking animals so that the farmer optimizes profit. Also, if you're dealing with beef, increasing the number of cows that will be weaned ultimately and then passed to the market for apologies, my network is shady. So these are the advantages of adopting artificial insemination by farmers. So rates of artificial insemination. General herd fertility. This is related usually to the cow. The cow fertility depends on a number of factors.
I'm sorry, it seems we just lost the speaker. I'm sure he would reconnect and return to the call. Thank you.
Please confirm if you can hear me.
Yes, we can hear you. Welcome back, sir. We
Sorry,
lost you.
my
Yes.
network is terrible. So where was the last place you had me?
The previous slide, sir.
Okay. So I was talking about the benefits of artificial insemination. Artificial insemination can be used for genetic improvement, such as increased milk production and fast growth rate in beef cattle. This is important it is in line with the national livestock transformation agenda. For example, you have the average milk production from our local cows to be an average of 1 liter per day. But with genetic improvement, we have increased milk production, particularly when crossed with breeds like the Holstein Friesian and the Grilando, as you can see in this picture. So it's important to have a good genetic breed to cross our local animals with. What I noticed with most farms is that they prefer to buy bulls because of the high rates of failures in artificial insemination. But with a bull in the farm, mostly the inbreeding rate is very high, which ultimately affects productivity of the offsprings. So artificial insemination, with the help of hybrid vigor, can help to increase productivity in our livestock. Also, AI is important for disease control, as there are some diseases that are transmitted through venereal transmission. So with AI, you are able to avoid that. Then we have increased fertility and a decrease in breeding costs. And then with the utilization of sex semen, you have increased herd productivity, as sex semen utilizes semen that has been sex sorted. So if a dairy farmer needs only heifers in his cow, in his herd, so with sex semen, he'll be able to get as many heifers as possible, which will serve as the feature of the herd. So what are the factors that affect the success rate of artificial insemination? General herd fertility. This is mostly related to female fertility, and it can be affected by a number of factors such as nutrition, diseases, management, and then the body condition score. We'll talk about that later. Then semen quality. This will include the quality of the semen itself, the semen handling procedure, whether it was properly transported in the cold chain or during the loading of the AI gun. Those procedures that mainly will cause reduce in fertility of the semen. Also, if you are keeping a bull, there are certain disease factors that can affect the bull and reduce the general fertility. So estrus detection rate, this is a major factor that affects success rate of artificial insemination. One of the major contribution is that about 40% of our zebu cows exhibit what we call silent heat, and they are not able to express the signs of estrus. So most observers will usually miss the signs of heat. But with technology, we have heat detection aids, which will include the use of podometers, the collars, which have ability to detect certain physiological changes during estrus and send the signals to a computer system that gives the farmer signals. We have the Lamar heat detector, as well as other such as the others, including the chimbal marker and the tail head painting. So these are detection aids. Also, with the advance of fixed time artificial insemination, this has the ability and the advantage of eliminating the need for heat detection. So we have been adopting this system in our insemination protocols, and we have been getting excellent results. Also, the inseminator efficiency. A lot has to do with the handling of the insemination process, such as when you deposit the semen in the anterior vagina or in the mid-cervix, or some people, instead of depositing the semen in the body of the uterus, they go ahead to deposit the semen in the uterine horns. This affects the general conception rate of any given heart. We'll have what you call the fertility equation, which deals with the four major factors that we mentioned above. These include the heart's fertility rate, the semen quality, estrus detection rate, and inseminator efficiency. So here I gave an example. If you have a heart fertility that is poor, probably due to malnutrition, diseases, or other factors, and it's recorded as 60%. And the other factors are excellent. You can see semen quality 95%, estrus detection rate 90%, and then efficiency of the inseminator at 98%. This will generally affect the fertility rate and draw it back to 50%. Now, check another farm that has a very good management system with the same parameters as related to the other factors. And you have a pregnancy rate at close to 80%. Now, also, it is not worth noting that if you have a good protocol that eliminates the need for heat detection, and that's what I refer to as the fixed time artificial insemination, then you would have only to deal with the heart fertility, semen quality, and the inseminator efficiency. This is one of the factors that contributed to a lot of success rates we recorded in the field. We have had success rate as high as 83%, ranging from 50 to 85%. Then the adoption of multiple ovulation and embryo transfer has several advantages, such as increased reproductive rate of individual animals or group of animals. It is not surgical in the cattle, but we use surgery for sheep and goats. For embryos can be transferred either fresh or frozen in the lab for future use. Then the entire procedure can be carried out in a farm. So this is a very good advantage. With my team in Genix breeding, we have demonstrated this, and we have had a success rate of up to 60%. And this has an advantage of high genetic rates gains, because if you are to use artificial insemination alone, each cow will deliver one calf per year with a good reproductive management. But with embryo transfer, one single good cow with high productivity can have as many as 8 to 10 offsprings with the use of embryo transfer. So this is a technology that can help fasten genetic improvement in Nigeria. However, assisted reproductive technologies have several bottlenecks. They require high technical skills. It requires training, and then not only academic training, but hands-on field experience and training in the laboratory. Also, the cost is high, particularly with embryo transfer, but also with artificial insemination. We have seen inseminators charging up to 100,000, 80 to 100,000 in the field. So a lot of farmers cannot afford that. Then management factors with poor nutrition, diseases that affect reproduction, the success rates of this assisted reproductive technology is usually low. So how do you improve reproductive efficiency? Maximizing profitability of any livestock farm depends on maximizing reproductive efficiency. This can be improved through increasing fertility rates. And we mentioned earlier on that fertility rates depends on the farm nutrition, absence of diseases, and then cow comfort and general good practices in cattle management. Reducing calving intervals, as I mentioned earlier, the calving interval of an ideal cattle farm should be 1 year. So each farmer is expected to have 1 calf per cow per year. But with all these several problems, we have a wider calving interval which affect profitability of the farmer. Then optimizing breeding strategies such as the adoption of fixed time artificial insemination and the use of newer protocols of synchronization is very vital for profitability. Then reducing pregnancy losses. This hinges upon good early diagnosis of reproductive disease, as well as a good herd health management program. Then nutrition. Nutrition is one of the most important factors that affect the success rate of reproductive programs. For optimal reproductive performance, then adequate nutrition should be provided. I've seen farmers that start up without establishing a source of nutrition for their cattle. And this is a major problem in the field. The lifespan of most farms will not exceed more than 2 to 5 years because of this initial mistake. So what we advise farmers is that before you buy one single heifer or cow, you should ensure that you establish a pasture land, manage it, and ensure that it has been well established before you now begin to introduce your animals, as this will reduce the high rate of high cost of feeding your animals. So poor nutrition can lead to delayed estrus or absence of estrus signs, reduced conception rates, early embryonic mortality, metabolic disease, especially in the late stages of pregnancy and the early stages of lactation. And then there's a general reduction in milk production, which affects the profit of the farmer. So what constitutes good nutrition? Good nutrition starts from the calf. Once a calf is born, there are certain practices that will help in optimizing the performance of the calf. This continues with the heifer. And from the field, I noticed that most farmers have poor nutrition for both the calf and the heifer, and they focus more on the adult animal, which is why the stages of body condition score of the cows at different stages of their life cycle. So because of the importance of early calf nutrition, we will briefly talk about the best practices in managing the neonatal calf. So it is expected that the calf should be fed 4 quarts of colostrum in the first 6 hours of life. This is because from 6 hours, you have the highest number of receptors for immunoglobulins, which are vital for protecting the calf and then ensuring a good future life. These receptors decrease as the hours go by. So you can see from the chart on the right-hand side that at 12 hours, it is reduced by 24 hours. You can see it's less than 20. And then it decreases such that by 3 days, it completely disappears from the intestines of the neonate. So it is essential to make sure that the calf suckles adequate and prompt quantities of high quality colostrum. Colostrum quality can be tested using a refractometer, which helps in monitoring the quality of colostrum. Then it is also important to provide clean, dry, and draft-free housing for the cows to minimize the outbreak of pneumonia. Feeding calf starters has also been shown to develop the rumen as early as possible, so that this allows for earlier weaning and increased nutrition in the early stages of the heifer life. This is very important for future productivity of the heifer. When do you wean animals? There's no specific age for weaning, but generally with good practices, you can wean them as early as 4 to 8 weeks. The weaning time depends on certain factors, which we'll discuss. It is good practice to reduce the liquid feed intake by 50% per day, 1 week prior to weaning. Observe the calves in individual housing for 1 to 2 weeks, and then the calf post-weaning should consume at least 2 kilograms of calf starter. The calf starter is a diet that is high in protein that is supplied to calves as early as 3 days of age. This helps in development of the rumen, because grains generally have been shown to increase the growth of the rumen papillae, which helps in the development of the rumen, so that by 1 to 2 months, the calf has the ability to consume hay and other adult ruminant feed. So also, it is good practice to vaccinate the neonatal calf at the specified period as recommended by the Heart Health Program. So what are the causes of neonatal death? Weakness is attributed to starvation at the early stage, particularly when you have dystocia. If you have dystocia, the veterinarian will rush to relieve the dystocia, and then he usually will abandon the neonate and concentrate on saving the life of the dam. This predisposes the neonate to starvation, hypothermia, hypoxia, and then subsequently we have development of neonatal diseases. Other causes of weakness includes postnatal infection from a dirty environment, uterine contamination, which leads to a decreased uterine involution in the dam, metabolic defects such as milk fever that affects the quality and quantity of the milk, congenital malformations, premature calving, and then trauma during forceful delivery in cases of dystocia. So the incidence of neonatal disease is shown in this pie chart, with scours or neonatal diarrhea having the highest chunk of the causes of mortality. And then you have respiratory diseases, calving problems, and others. So we'll focus more on these two major neonatal diseases. So in order for you to diagnose neonatal diarrhea, there's a scoring system developed by the Penn State University, and they scored the type of feces from normal to semi-formed pasty feces to loose but pasty feces, which has a large amount of fluid in it. Then watery feces with sometimes you see blood in the feces. So for you to manage the scour or neonatal diarrhea, you need to score the feces quality of the neonates, and this requires that those that have a score 1 are not treated because it's a normal feces, but 2 or 3 will require treatment. And then intensity of treatment depends on the level of dehydration, which can be assessed from the figure below. 0 to 6% dehydration will have minimal clinical signs, but from 6 to 8, the cows become depressed. And then anything from 8 to 14, this requires fluid therapy. So for you to treat the cause of neonatal diarrhea, you need to identify the causative organism. And usually, ranging from day 1 to 1 week, there are certain causes of neonatal disease, which are shown in this chart. So E. coli is the number 1, which causes neonatal diarrhea from 1 to 5 days of age. And this is due to contamination from the calving pen, the floor of the calving pen, which emphasized the need for proper hygiene. E. coli diarrhea is not only about the E. coli organism, but they produce endotoxins, which aggravates the situation and affect the response to treatment. Others are Clostridium, which can cause diarrhea from 1 to 15 days of age, Salmonella from 4 to 28 days. The viruses, the rotavirus and coronavirus, from 5 days to 1 month. Then we have less common Cryptosporidium, but it can occur from 5 to 20 days, and then Coccidia, anything from 3 weeks, due to the life cycle of the parasite. So it's important to identify the cause of the diarrhea so that you target specific treatments towards the causative organism. Then you have to generally rehydrate the neonates to avoid the effect of dehydration. The other major cause of neonatal death is pneumonia. Pneumonia should be identified from the clinical signs, which is shown in the table on the right side. You have to get the clinical signs, and then you score the severity of the pneumonia based on these clinical signs. So if the score is between 0 and 3, no treatment is required. So all you need is to get a very good, improve the ventilation of the housing and improve nutritional intake of the neonate. From score 4, you need to institute therapy, which will largely depend on isolation of the causative organism, so that you institute specific therapy. Okay, so having a good management for the calf will lead to a very good heifer. The heifer needs to also be managed nutritionally. They should grow at a rate of 0.5 to 0.8 kilogram per day, depending on the breed. With our local breed, you expect a lower growth rate, and also depends on the management and the nutrition. Then they should mature at, they should calve for the first time when they reach 85 to 90% of mature body weight. So for local breeds like Bunaji, which has an average weight of 250 kg, they should attain 90% of that weight at first calving. For field situation, we have recorded first calving in Bunaji and Sokoto Gudali cows as late as 4 to 5 years of age. This is due to poor nutrition from the onset of life of the neonate, and then due to the extensive management system, which mostly depends on scavenging of feed of the animal. So nutrition plays a vital role in reproductive life of the animal. Also, it is not only the body weight, but the height of the heifers should be at optimum level. So for heifers of our local breeds, they should attain between 100 to 120 centimeters height at the withers. For Bunaji and Sokoto Gudali, the adult weight is around 170 centimeters. So at least the heifer should be at around 120 centimeter height, so that it supports the structure to allow smooth gestation. Heifer nutrition, the heifer should be fed on grass and hay with high quality hay being supplied from 2 weeks post weaning. Do not overfeed heifers with high energy diets, as this might affect the reproductive performance as well as the lactation, forced lactation of the heifer. So it is important to avoid high concentrate diets, and diets of these cows should be mostly based on forages, which will constitute about 70 to 80% of their diets. Then the concentrate feeds should be given at maintenance ration. Then reproductive management should be based on the following: improved breeding protocols, as we mentioned earlier, like estrus synchronization, heat detection, and then the farmer should be able to set goals, or the veterinarian can set goals for the farmer, so that we have certain requirements for optimal performance. For example, you can say age at first calving for our local breeds, you can set it at 2.5 to 3 years. But for exotic animals, usually it is 1 year. So crossbred animals should have a value in between. Also, the calving interval should be set at 1 year. That means each farmer is expected to have 1 calf per cow per year. We should use technology for pregnancy diagnosis, especially ultrasound, and then progesterone assay using ELISA. Then data-driven breeding strategies should be employed so that we're able to record reproductive performance of the animal at each stage of its life cycle. Here is an example of the use of ultrasonography in reproductive management. So from calving to 30 days, the veterinarian can use ultrasound to detect the progress of uterine involution, such that by 30 days, if uterine involution is complete, then he can begin the AI protocol for the insemination of the cows. But this also depends on the postpartum nutrition of the cow, as well as the absence of disease. So it is important to monitor the uterine involution so that you are able to breed the animal as early as possible. So usually, good practice entails that you breed the cow 80 days postpartum or less. This will depend on the progress of uterine involution. Then you should be able to check pregnancy at 100 days, 110 days or less, depending on when you bred the animals. Usually, the target is 28 to 35 days post-insemination. So with the use of ultrasound, you'll be able to detect non-pregnant animals so that you rebreed them in less than 120 days. And then after 60 days, you can use either rectal palpation or still ultrasonography to confirm pregnancy. So this is very important. So with the use of ultrasonography, you have been able to detect pregnancy from 30 days to 37 days, which will give you a very good reproductive efficiency. Diagnosis of reproductive problems. Reproductive problems can be detected as early as possible so that you avoid economic losses. Such target diseases include brucellosis, leptospirosis, campylobacteriosis, trichomonosis, and trypanosomosis. The last 3 are of interest to me as we do artificial insemination, because they cause early embryonic death. And with early embryonic death, you will not see any clinical sign of abortion. So the farmer cannot detect when pregnancy losses occur. So it is important to detect these diseases and then treat for them. It is good to know that with campylobacteriosis and trichomonosis, transmission is through venereal means. So with AI, we have less of that problem. But if the cows have been previously exposed to these diseases, it is difficult to diagnose them, as mostly our minds are not set to this disease. Brucellosis is a major problem in the field, as the management only entails that we test and call the animals that are affected. So it has more significant economic impact in the reproductive performance of the farm. Other non-infectious causes include malnutrition. With this, if you are able to monitor the body condition score of the animals, you'll be able to diagnose this. Heat stress, especially now that we're having global warming and general increase in environmental temperature. Heat stress have been shown to affect pregnancy rates, especially at the early stages. Then mycotoxicosis. Moldy feeds can lead to mycotoxicosis. Mycotoxins of importance in reproduction are mostly those related to zearalenone and aflatoxins, as well as aflatoxins. It usually affects the fecundity of the animal, as well as the ovarian structure and function. So it's important also to detect presence of mycotoxins in the feed of our animals. And lastly, we'll talk about bull fertility management. It is important, if the farmer is not using artificial insemination, to carry out breeding soundness examination of the bull. Also, seminology, with the use of newer technologies, it is easier to detect fertility problems that are not grossly seen with conventional methods of semen analysis. CASA, it's expensive, so it's not very common in the field. But we have newer technologies that can be used, like the 4MID kits. Well, I'll talk about it next. Then lameness scoring. Lameness is important for breeding bulls, as lameness can affect the mounting ability of the bull. So it's important to detect lameness and treat it as early as possible before the breeding season. The 4MID kit is an innovative tool that is used to predict long-lasting sperm motility and function. This makes use of surface protein on the spermatozoa that is referred to as pro-AKAP4. This protein can be detected by this kit, which is an effective means of detecting sperm motility marker. So once you use this kit, the results are classified into 4. Any concentration of this protein greater than 60 nanograms per 10 million spermatozoa is considered excellent, and between 40 to 60 is very good. 15 to 40 is good, and then anything less than 15 is considered poor. So also, we can also use this not only for live bulls, but for semen we purchase from any source. We can use it to detect the quality of the semen, so as to reduce success rates increase success rates in artificial insemination. In conclusion, effective herd health management is essential in maximizing profitability in livestock farm. By improving reproductive efficiency, reducing disease incidence, and enhancing overall herd health, the farmer is able to maximize profit, and the business progresses. Thank you very much. I'll take questions now.
Wow. This indeed is a wonderful presentation. I think there are a lot of advances in this field since we left school. We are happy you have brought this to bear to us. I think while you were speaking, sir, Dr. Olutoyin Adetuberu, NVMA president, joined us. I don't know if she's still on this call. Dr. Adetuberu, welcome, ma. Yes, she's.
Thank you. Good morning, all.
Yes, welcome, ma. Good morning. Thank you. So at this point, we would want to take comments and questions. I want to believe while the presenter was on, a few of us had questions, one or two things, gray areas, one or two clarifications you would want. The floor is open. If you are able to, if you want to say something, you can put up your hands quickly. We'll give you the floor. If you prefer typing, you can also type your questions. We can access that. Sir, briefly, let me just ask this while our the house gets together, get their questions together. Sir, as it concerns reproductive technologies, are there ethical concerns for these animals? You know, sometimes people would say, these animals should naturally mate and that is how it should be. But then we have come up with these technologies. Are there concerns, ethical concerns?
Okay, you mean ethical concerns as related to the use of artificial insemination?
Yes, sir. Yes, sir.
Okay, yes, I've come across some concerns by animal welfare activists that these animals should be allowed to undergo their natural reproductive processes. However, we have a food insecurity problem in developing countries, and we need to do something to increase the productivity of our livestock. Otherwise, the one of the SDG goals cannot be attained, especially in developing countries. So it's important to adopt these reproductive biotechnologies in order to increase the general productivity of our animals. And also with selective breeding, we can arrest the menace of global warming, as literature has reported that livestock, particularly cattle, also contributes to emission of greenhouse gases, which leads to global warming. So with selective breeding, we can have animals that are more productive. So if you have animals that are more productive, you can reduce the total number of cattle you keep in the herd. As I gave the example, one of our local breeds will produce an average of 1 liter per day. But if you take a look at the Frisian cows, a very good Frisian cow with optimal nutrition can produce between 25 to 33 liters. So that means if you have just 3 Frisian cows, you can produce what 100 Bunaji cows, milking cows, will produce. So you can see with lower number of cows, we have lesser emission of greenhouse gases. And this is very important for fighting the effect of climate change. Thank you very much.
Thank you, sir. I think in the chat box, Professor Caleb Kudi dropped a related question. He is asking, what is the place of animal welfare in interfering with breeding process? I think it's, is this so different, sir?
Yeah, I think I've responded to that.
Yes, yes. Thank you, sir. Dr. Rebecca Andeshi is asking regarding embryo transplant. How often is this practice in Nigeria? And if often, the offspring from such procedure, what is their reproductive capacity like? And how much is the cost of a procedure?
Okay, so from our practice, Gendex Nigerian method, we have one of our specialists, Dr. Yerima. Yes, we have undergone this process and we have had a success rate. We did embryo transfer, about 15 cows, and 8 of the embryos were viable and proceeded to natural pregnancy, and we have delivered. So as they haven't reached maturity yet, so that we'll see their performance in terms of productivity. But it's at a very, very embryonic stage, and we hope to see more of it in the future.
Thank you, sir. A young vet, I want to believe, is asking, are there internship positions in your organization, sir?
Okay, for now, we have not opened space for that, but I believe in the nearest future, we are still training other young vets so that they'll join our team, as the demand for our services is growing and we are limited geographically. So we are training more people so that they'll be able to join the team, and then would continue the services.
Okay, thank you. There's a question from Dr. Agu, or a comment, I think. Okay, a question and a comment. Are all these latest technologies taught and some at least practiced in our veterinary teaching hospitals across the country? If
okay,
no,
so
what is the effort of VCN to help try to make it available? Well, thank God we have the VCN's vice president on this call. He may respond to the second part of it. Dr. Babashani is also a staff of veterinary teaching hospital, Ahmadu Bello University, Zaria. So I want to believe he would not keep knowledge to himself. He would share it with his students. Can you respond to that, sir?
Okay, definitely. At least to a large extent, theoretically, it is being taught across all vet schools. But I think what is lacking is the hands-on practice. One of the setbacks is the absence of highly skilled veterinarians that can perform, especially the embryo transfer. And then also, we have a National Animal Production Research Institute in Shika, here in Zaria. You can always register with them for short-term hands-on courses, AI particularly, and they have been doing an excellent job over the years. Is that all about the question?
Yes, sir. The second leg of the question, Dr. Bala Mohammed, I don't know if you want to say something.
Okay, thank you so very much, my teacher and brother, for an excellent presentation, and also for those who have asked a question. As you may be aware, the council is in the process of trying to see how we are going to tweak the curriculum and then the style of teaching veterinary medicine in our universities. And you will also, I chair the committee, and then my own teacher, Professor Caleb, has been part of those who came up with the memo and then a roadmap as to how we can achieve that aspect. Now, until not only this aspect, you know, there are so many aspects that our economy is in dire need of the vets to doing this. And then it's an irony that you have thousands of qualified veterinarians underutilized or not just doing anything veterinary medicine. So the whole idea, and that is what I have also borrowed to launch as part of my company's corporate social responsibility, to launch what we call COTOG, Connecting Town to Gown. There is no way that what the speaker has said today will be said to undergraduate, and then you expect that the moment they graduate, they will be able to hit their ground running. I kept listening and I say, oh my God, as a vetpreneur, this is an opportunity to make money. There are lots of opportunity. A lot of people need to improve the capacity of our cattle, be it beef or dairy. And there is no any other way to it than artificial insemination, where you have those advantages that as he has listed. So we are working on it, and the economy and our political office holders need to understand that you don't achieve development without the ivory towers, the universities. And therefore, connecting town to gown is still an agenda very strong on my mind, not because I'm even a board member or I'm the one heading that committee. It has always been so, and that is why I tend to learn more from my younger colleagues at work than even from my teachers. It is all about practice, and I think very soon with the new administration coming, we are going to make a lot of requests to support the university, get them out of the gown to town, and then we should also, for the private, the industry players, the private practitioner, they must also go back to the university, not for certificate, but to partner with people like Baba Shani, people like Professor Caleb, to repeat those things that he has told us years ago on the field, on the case. And that way, once you see, I mean, there is a Chinese dictum that said, if you tell me, I will forget. If you show me, I will remember. If you let me do it, I will never forget. And that is just the principle that I think we should use in administering veterinary education. Thank you so very much, sir.
Thank you, sir, for that beautiful couple. Dr. Haruna, your hand is up. I don't know. You can unmute and speak, Dr. Haruna.
Yeah, thank you for this opportunity, and thank you, Baba Shani, for a wonderful presentation. So my question goes around, what are the challenges you face when it comes to ticks and tick-borne pathogen? Because I have an understanding that some of these pathogens or the ticks themselves become more virulent when they encounter exotic breeds or crossbreed as compared to our indigenous cattle breed. So I want to know if there's any challenges you've come across when it comes to ticks, or what have you done to even manage to deal with the impact of ticks and tick-borne pathogen to all your livestock, especially the exotic breeds and the crossbreed. Thank you.
Okay, thank you very much, Dr. Haruna. I've had a nasty encounter with dermatophilosis and cardiosis, which are both tick-transmitted disease. Also anaplasmosis, especially with exotic cows. They don't have strong feet for resisting these tropical diseases, and it actually affects the general productivity and even reproduction of these animals, particularly with dermatophilosis. It affects the genital organs, the external genitalia, and particularly in the bulls. We have seen a case where the sperm count was limited to 0 sperm from a particular bull affected by dermatophillosis in his scrotum. So the main control and prevention strategy is to control the ticks. Usually with commercial farms, we advocate the use of dips. With dips, you have lower incidences of these tick-borne diseases. And also with dip, if the animals have if they have dermatophillosis, it also has a way. I think organophosphates have been reported to have a way of clearing the bacteria from the skin. So we have recommendations from research done in ABU from late Professor U.S. Abdullahi. He has worked extensively on dermatophillosis, particularly in crossbred and exotic cattle. And he has reported higher incidence of dermatophillosis in crossbred cattle than local breeds, and then also in exotic cattle. So the treatment, we have several trials being done, but personally, there was a paper I presented in MVMA Congress in 2017, the effects of dermatophillosis on production and reproduction of cattle. And we have seen drastic effect on milk production, as well as general productivity of the herd, emaciation, and even death. So it's important to control the tick that transmit these diseases, and then with proper tick control, you have lower incidence of such disease. Also, with one of the major hindrances to exotic cow importation in Nigeria is occurrence of cardiosis and anaplasmosis, which is mostly ignored by veterinarians, but I've seen terrible cases of anaplasmosis, which are difficult to treat. So it's important to control the ticks, and the tick control is, I cannot overemphasize the importance of tick control. Thank you very much.
Thank you, sir. We have a few more questions on the chat box. Dr. Gaddafi Mohammed is asking, for multiple embryo transfer, how do we deal with the issue of free Martinism?
Okay, so you need to understand the technicalities behind multiple ovulation and embryo transfer. So first, there's what we call multiple ovulation. So this multiple ovulation, you have a cow that has high good genetic traits, and you want to multiply her genetics in your herd. So that will serve as your donor cow. The donor cow is prepared by giving multiple injections of FSH, and we'll have a protocol for that. So you have first the recruitment of these follicles, and then they attain dominance, and you have multiple of the dominant follicles, which you will now eventually make to ovulate by giving the hormones. If you are interested in the protocols, I'll share with you. But the purpose of this is to have multiple. You know, the cow has only one ova produced during ovulation. But with influence of these hormones, you can manipulate the cow to produce more than one ova. So this is what we call multiple ovulation. So after you cause this multiple ovulation, from the onset of the process of the protocol of multiple ovulation, you also prepare the recipient cows, which we refer to as the surrogate cows, so that they will be in the same stage of the reproductive cycle with the donor cow. Well, you'll see the need for that. So after you have induced ovulation in this cow, you will now inseminate her so that there will be fertilization. And after 7 to 8 days of fertilization, you will now flush these multiple embryo that have been formed as a result of the ovulation, or as a result of the fertilization. So once you flush them, you examine them for presence of a viable blastocyst. Once you identify a blastocyst that is viable, you can now either freshly transfer it to the recipient cows, which could be, depending on the number of viable embryo, you can now transfer it to as many cows that you have prepared as possible. So that means it's not the same mother that will carry them to term, but you have surrogate mothers that will help her carry them to term. Hope that clears the whole issue of prematurnism. So they are not being housed in the same cow. There's no chimerism of blood, and there's no occurrence of prematurnism. Hope that clears your confusion.
Dr. Gaddafi. All right, I think we can move on. Dr. Salahu Nasiru is asking, before you engage a farm, are there minimum requirements that the farm has to meet in terms of feed availability, spacing, housing, etc., and so on, just to ensure the success of your intervention? You know, if they do not have good processes, when you come and you do whatever, irrespective of your competency and technicalities, at the end of the day, the success rate is what would determine if you have done a good job. Whereas it may not be factors within your own control.
Okay, so this brings me back to the issue of factors affecting success rate and the fertility equation. So I mentioned during my presentation that these factors are mutually inclusive. So you cannot rule out one, as we have seen in the calculation here. You cannot have poor hard fertility and have a good AI success rate. So they are mutually inclusive. You should ensure a good nutrition in the heart, a good heart health program. If the animals are sick, for example, last month I was in Ilorin. The first day I went there to examine the animals for fitness, I noticed that they had clinical signs of trypanosomosis because the area was an SSA endemic area. So I drew the attention of the farm vet that they need to treat for trypanosomosis before we begin the insemination process, because trypanosomosis can generally affect the success rate of the insemination process. Also, nutrition, as I said, nutrition cannot, the influence of nutrition can never be overemphasized. So the animal needs to have a good body condition score, which is a measure of the quality of nutrition they're getting. Also, important is the need for mineral supplementation, because there are a lot of minerals and vitamins that affect the reproductive process. So it's important to ensure this. Apart from these two, I think the handling facility, we usually tell farmers to get a good handling facility to minimize stress during the insemination process. Generally, these are the requirements. As for the number of cows, yes, it depends on location also. I have some neighbors that have 2 or 3 cows that will force me to do insemination to them, but it's not economically viable to inseminate 1 cow. You will not know whether you have 100% success or 100% failure. So it's important for the farmer to have at least a minimum of 5 cows so that we're able to assess the success rate of the insemination process. Hope that answers the question.
Yes, fine. So you talked about restraining facilities. to reduce stress on the animal, I was also considering you, sir, to also protect you. One of my lecturers will say, when you want to handle an animal, you give yourself an exit.
That's true.
Your exit route in case the animal turns.
That's true. That's true.
Agrovet or Agivet, your hand was up. I don't know if you still want to say something. Otherwise, we move back. Okay, please.
Thank you, sir, and thank you, Dr.
Please,
Mohammed,
can we know
the
your name?
presentation.
We're just saying maybe your business name. Let's get the name.
Okay, I am Dr. Daphne Peter. I'm joining from Jos.
Okay. Welcome, ma'am.
Yes, sir. Thank you so much for the presentation. I think it was clear. Initially, I also wanted to ask about the multiple embryo transfer. So I wanted to ask if there was going to be issues of twinning, if it was going to impact on something like the weight and other factors as well. But I think it was properly explained that you have a donor and you have surrogates. So I believe every cow would just have to be a donor for just one calf, and then we wouldn't have all those challenges. Thank you very much.
You're welcome.
Thank you. I think, can I get this question right? There's a question in the chat box. I'm not so clear. Dr. Jimiren? Hello, sir. Okay, it seems he has network issues or something. Well, with these questions, okay, there's one more comment from Professor Caleb. I think it's a follow-up to the question and the comment. His advice is that we should allow farmers decide their own goals rather than the veterinarians doing that. I agree with you very well. I think this is a rider to the earlier issues on welfare, ethical issues we raised, comparing the natural breeding and the artificial insemination, embryo transfer, and the others. With this, we have come to the end of today's session. Dr. Ibrahim Dauda wanted to say something. Dr. Dauda?
Yes, sir. Good morning, everybody. Thank you all for joining. Thank you for the wonderful engagement. And most importantly, to my own personal professor, Professor Babashani. So I must say your reputation precedes you, because I've been hearing the name for a long time. Unfortunately, you didn't lecture me, but then I'm always open to your tutelage. And of course, all of your students stay very amazing things about you. And today I must say that I see why now. And as we've been saying to teachers since we were in primary school, that your reward is in heaven. We thank you so very much for this wonderful opportunity. On behalf of the MVMA FCT, the entire members and of the ESCOs, I would like to say a very big thank you to you. Of course, we cannot pay you rather than to show gratitude. And I would like to say again a very big thank you to you. And I hope next time, soon enough, we call on you. We hope you would heed our call. And lastly, the Vice President of the Veterinary Council of Nigeria mentioned a proposition to rejig the veterinary curriculum. And I would say what's missing mostly is the hands-on, like you rightfully mentioned, sir. And it will go a long way if your organization opens up spaces for mentorship for we, the young vets out here. And with that, I would like to say thank you very much, sir. And thank you to everybody that joined, and have a wonderful day. Thank you so much, sir.
Okay, thank you very much, Dr. Dauda. Point of correction, I'm not a professor.
At least not on papers.
My own personal prof, sir.
That's what I'm saying. Not on the papers, but not in the book. we know we know the stuff you are made up of, sir.
We have ethics in the academia.
Thank you all for joining. I don't know if we can just put on our videos while we end this call, so we see our faces. Thank you. Thank you. Thank you.
Yes.
Thank you.
I see a lot of my professors.
Thank you.
My professor of nutrition, feed and feeding, Professor Ebitoye.
Oh, really?
Thank
sorry,
you so very much, sir. Thank you.
Nice to have you here, sir. Thank you so much. Thank you so much, sir.
Check with to remember everything in terms of even
See you
the
next time. Bye.
by Monday.
So yeah, so we're written it for him, but he said we're going to pay a city, but confirmed it.